Hi, and good evening to the final webinar in this series on equine acupressure to support the digestive system. As most of you know, we'll be having time for questions at the end of this. But if you have any questions during the presentation, please use the chat function. I'll keep an eye on it. And if it fits in, I'll answer it straight away. Otherwise, we'll have time for it at the end. So the digestive system, we will have a quick look on the anatomy, but only really we won't go into any depth. Then we look at prevention and common diseases of the digestive tract. So what can we do apart from acupressure or any other inventions to basically try to avoid them so that our horses don't get them in the first place. The digestion in TCM. So what's the TCM view on digestive problems or the functioning of the digestive system? And then we finish with certain acupoints for certain issues and to support the digestive system. And then we have some time for questions at the end. So the digestive system, it's like first with the way the digestive system of the horses is built. In a natural environment, they would be continuously moving, grazing and browsing, and that for about 16 to 18 hours per day. So, and that's how the digestive system adapted. So what we often still do in terms of the way we manage is quite goes quite against it and can be then quite detrimental to it, with having them stabled for long hours, having them not continuously having something available to eat and things like that. And also, of course, they usually live in social groups together. And the diet as such would have mainly consisted of forage like grasses, herbs, and leaves, and where the quality of the food was often low, especially during dry summers or winter month. And that's how it adapted. So to a continuous intake of small portions of feeds throughout the day, where the diet is high in low energy fiber, but low in more concentrated forms of energy, such as starch. And our goal, just to avoid any issues that are caused by nutrition, should be just to replicate as much as possible the way we feed our horses, so that they have roughage, that they have access to roughage the major part of the day, if not all day. And but we will look at that in a moment a bit more in detail. And because the digestive system has a comparatively small stomach that is combined with a very long intestinal tract. So the stomach only has a volume, the capacity to hold 8 to 15 liters. But the small intestine has a length of 20 to 30 meters and the large intestine of 8 to 10 meters. So that's quite long. And that means that the whole digestive system of the horse is basically like a tube, which is approximately 40 meters long. And that starts basically with the mouth, the entrance in the oral cavity, and then goes all the way through the body with the main parts like the stomach and the small intestine, large intestine, and then ends with the anus. But there are also several glands connected to that, like the salivary glands and the large accessory glands. So, but with the stomach, we already said that small amounts throughout the day so that it doesn't get too full and causes issues. And that means like roughage can be provided throughout the day, all day long, but the concentrated feed should be fed in several small portions throughout the day. That's ideally. But that's, of course, depends on the way we are able to manage everything. There should also be access to clean and fresh water available all day. And the roughage is particularly important, the access to it, because through chewing, the horse produces saliva, which is very important for the digestive process, and therefore also for the health of the horse. Because the longer the horse chews, the more saliva is produced. So, for example, an intake of 1 kilo of hay results in the production of around 4 liters of saliva. But 1 kilo of concentrate feed only produces around 1 liter of saliva. So and there shouldn't be, horses shouldn't be longer than 4 hours without any access to feed. So there shouldn't be any long breaks. And that's one thing, how we can support basically to maintain the digestive tract, the digestive system healthy. So that's the quality of the roughage and the feed in general is important, of course, as well. Then we can further add to preventing issues in that we don't add any sudden changes of feed. Changes should always be introduced gradually. Then the management, the way we feed, stabling, turnout, etc. And stress avoidance. That can be all kinds of stress. I have also an overlap here because with other risk factors, like for example, competition, intensive training, or herd dynamics, transport, that all can add to stress. And stress is basically one major part in causing digestive issues. Also, for example, we'll have a look at ulcers. With the development of ulcers, stress is a very, very huge factor. And then movement, of course, because it's also the horse usually would move around slowly the major part of the day. And we can only basically help with that with turnout and the exercise. Another risk factor are, of course, parasites. So we should have good worming management routine in place. Of course, there's also the issue with overworming and resistances. But if we can take accounts and things like that, so it's just something we should be aware of. That plays a role in digestive issues as well. So, and it can, for example, also cause colic. Then certain medications like bute is something like, and other inflammatory and painkillers. And signs that there are problems are, for example, colic, but we will look at colic again, diarrhea, behavior changes, for example, aggression. There are, of course, certain signs that may indicate an issue of the digestive system, and but it can be an indication of other issues as well. So changes of body temperature as well, a dull coat, inappetency, weight loss, changed eating behavior and patterns, also the hoof quality. For example, in chronic ulcers, the hoof quality may get bad. Resistance during grooming due to pain, drooling or teeth grinding, that's a few of them that can indicate that there's something wrong in the digestive tract. And then to the ulcers, the equine gastric ulcer syndrome, they are very prevalent in horses, unfortunately. And there are different studies that have different numbers, but like some of them, like we have more than 90% of racehorses that showed ulcers, 93% of endurance horses during the racing season, 37 to 66% of sport and leisure horses. So it's not only the competition horses, the performance horses, and it's also, I didn't mention it before, also horses that don't really have to work very hard, but maybe in an unfortunate group setting, for example, with herd dynamics that cause stress to them, they may develop also as a result of that, for example. So basically all kinds of horse populations are affected. But of course, through the pressure in the performance sector, they have a bit of a higher number here. Also 71% of brood mares and even 51% of foals. So I think that shows us that we really have to look at our ways of how we manage horses and what lifestyle we are able to offer them. So, and colic, I mean, it's another one of the very, very common issues we have to deal with. But colic as such, the term means every form of abdominal pain. So mostly that are problems of the digestive system, but it may involve also issues of other organ systems, such as the urinary system or the reproductive tract. Also, colic is of course something, I've added it here and I have a few acupoints later, but colic as such is an emergency and it's the time to call the vet. And acupressure or acupuncture can only be a support. So this belongs in the hand of a veterinary surgeon, and it's just when we are waiting for the vet, we may support the horse with certain acupressure points. So symptoms for colic, I mean, they are well known, but there are quite a number of them. So that can be that the horse is avoiding to eat, looks back at the flanks, paws the ground, then phlegm, the curling up of the top lip, standing in a stretched position, lying down at unusual times, lying in unusual positions, also lying down repeatedly, like standing up, lying down again, and rolling in unusual paces or repeatedly, sweating, increased abdominal circumference, and increased breathing rate, increased heart rate, increased capillary refill time, and mucous membranes that are either very pale or very red. So diarrhea, it's, I mean, if you have really one occasion or two with diarrhea, it's usually goes without consequences. But if you have a more extended period, you may see weight loss, also a change of the hair coat, inner patterns in general because of the discomfort that comes with it, increased body temperature, and signs of dehydration. So the water intake that is lost through the diarrhea becomes visible. So and when we look at the digestion, also I wanted to add, because we had looked at the immune system in the second session, and also the digestive, the gut plays a very big part in the functioning of the immune system. And basically 70% of the immune system is in the gut. So that shows how important the health of the horse's digestive and the gut system is for having an immune system that is able and strong enough to defend against any exogenic, pathogenic factors. So, and we will start with the spleen, because the spleen has a very, very important role in the digestive process in the in traditional Chinese medicine view. So we look at the major meridian again, and for those attending this for the first time, there we are. There are 12 major meridians and associated organs, who are those which run bilateral on the horse's body. And the spleen meridian starts here on the coronary band, runs medially up the leg, and then this would come out on the opposite side, but just to make it visible. So this one would basically run up here on the inside of the leg, and then it comes out here on the abdomen, goes here, and ends here with spleen 21. That's the last point, acupoint on the spleen meridian. So, and the spleen's function is transformation and transport of food, basically the digestive process. And it's there, it's very closely connected to the stomach. And also, who attended previous sessions, when we look at the 5 elements, the spleen and the stomach belong to the element of earth, and they are basically the center of the body and the middle of the body. And they are also, the spleen would be the yin meridian and organ, and the stomach the yang meridian and organ. And they are far closer connected than the other meridians and organs. And they are also in the literature, in the most basic literature of traditional Chinese medicine. There's usually one chapter for each meridian organ, but the spleen and stomach are basically dealt with in one chapter. So that shows how close they basically are. And the food first goes to the stomach, and we'll look at what the stomach does in a minute, but it then is transported to the spleen, and the major processes of transformation actually happens then in the spleen, which separates them into pure and impure components, sends them to the small intestine, who again transforms. It takes the impure. The pure is already sent to the body to nourish it, but the impure is sent to the small intestine, where it's again processed and transformed. And the small intestine then sends the clean, the pure components back to the spleen, which uses it again to further nourish the body. And then the small intestine takes the impure and sends it further to the large intestine, where it's again transformed and transported further to part of it again to basically nourish the body, but the rest of it is excreted. And the digestion in the spleen is not, as in our Western understanding, limited to the to physical functions, but it also includes intellectual, emotional, and it should be psychological digestion. So it goes on every level, like the intellect, the body, and emotions. It's just digestion in every sense. And there we have the stomach, and we look at the flow of the stomach meridian, and that's here the brown line, and it starts beneath the eye and goes forward, then goes down here, runs up here, but goes back down again, and then runs down the neck here in the groove, and then comes down here and runs all the way along the belly, and craniolateral, very cranial, but it's slightly lateral on the hind leg, and it runs out, and it's basically ends on at the center of the coronary band with stomach 45, the last point on the stomach meridian. And I said that the spleen is the yin meridian and the stomach the yang meridian. And we had, in the first session, we had looked at the opposites of yin and yang, and that usually yin is basically runs inside, is on the belly, and yang on the back and laterally. But the stomach meridian here is the exception. It runs, even it runs quite dorsal on the abdomen. It's a yang meridian. And the stomach absorbs food for a short time only, because then it's the major processes happen in the spleen. And it's basically, it takes up the food for fermentation and ripening. It's like a big cauldron where everything is cooked before it's moved forward. And then it's transported further to the spleen. And it also controls the descent of qi, and it is the origin of fluids. And it said that it is the sea of water and grain, and the great source of nourishment for all sung and fu organs. We said it, that is a yang organ, and it's responsible for the absorbing of food, and in close connection to the spleen. And the interaction between the two of them is extremely important. They both together are the officials who are responsible for food storage, and the yang meridian that runs along the abdomen. And do you have any questions so far? I'd also like, because I spoke about the pure and the impure, that is basically where the spleen basically separates the pure and the impure. That's not, the impure is not basically, doesn't equal waste, even though part of the impure then later goes through the large intestine and then to excretion. Part of it still is available to the body and serves certain functions. And back to the acupoints, we will look at a few that are good to use with ulcers. But they are, of course, the points we look at are also generally suitable to support the digestive system as such. So, and we start with a point that's not really, when we first look at it, doesn't seem to have anything to do with the spleen and the stomach, but it's actually a good point to start with when we deal with digestive problems and ulcers in particular, because it does harmonize the stomach, and it belongs to the pericardium. It's pericardium 6. And its location, it's very easy to locate, because depending on the literature, is either directly cranial or below the chestnut, medially on the foreleg. Of course, we can't really reach it properly below the chestnut, but what we can do is that we slightly move the skin with the chestnut a bit back, and then access it, or just directly cranial to the chestnut. If I have the chestnut here, I just go on mid-level, just cranially to it. It also calms the mind, so it's generally a point that you can use for that, but that's also helpful if you are working with horses that are suffering from ulcers, which can be quite painful and stressful as such. So indications are gastritis, and ulcers, but also problems in the chest and shoulder area, and as a local point, pain and swellings medially on the foreleg. And another point you can that is good to include in the if you want to address ulcers is large intestine 4. It's medial on the foreleg, distal to the proximal end of the splint bone, between the splint bone and the cannon bone. And apart from using it for the digestive issues, it's a point that stimulates the immune system. Also, generally for pain, that's also one of the reasons to include it for the treatment of ulcers, because that's involves pain quite often. Pain of the shoulder, the neck, and the forelimb. So, and it's also the influential point of the face and the head. So you can use it if there are problems in that area as well. But that's particularly a point that is contraindicated during pregnancy. For anybody that's attending the first time here today, we do not work on infant mares, because when you start working with acupressure, because there are points that can cause abortion. So large intestine is particularly a point to avoid for horses during pregnancy. Also, we don't work with acupressure directly before or after feeding hard feed, if there are sudden behavior changes, because we want to be sure that there are not any physical issues, that there's no pain or anything like that. And in emergencies, that's time to call the vet. In a moment, we look at large intestine 11, and some may remember we had large intestine 11 when we were working with the immune system. So large intestine 4 is equally a point that you can use to support the immune system in general. But with horses, it's if you only want to work with one point, then choose large intestine 11 when it comes to pain or immune system issues. With humans, you would use, or also with dogs, you would use large intestine 4, and it's actually the point here in between your thumb and your index finger, and that's a point you can use if you have pain, you have a headache, you're getting a cold. That's a good point to use. So then we have large intestine 11. So this is located in the depression at the lateral end of the transverse cubital crease, cranial to the elbow, and just cranial to the lateral epicondyle of the humerus here. And if you're struggling finding it on the horse standing, you can actually lift up the leg, and then you can maybe move the leg a bit, and then you should be able to find the depression quite easily. It's a generally tonifying point, and as said before, immune stimulation, fever, fall and pain, inflammation and stiffness, particularly the shoulder and the elbow because of its location and because of its general function, a good point to include for problems with ulcers. And the digestive system in general, as you are addressing the large intestine through it, of course. And then we have governing vessel 1. Governing vessel is, in addition to the 12 major meridians, in traditional Chinese medicine, there are 8 extraordinary vessels. The majority of them doesn't have their own acupoints. They are basically connected to certain acupoints on the major meridians. A part of 2 extraordinary vessels, and one of them is the governing vessels. The other one is the conception vessel. And they are quite easy, the flow of them, because the governing vessel starts here and it then runs all the way along the dorsal midline, just in the middle, also over the head, and ends just above the upper lip. And the conception vessel starts just beneath the anus. This starts just above the anus, just beneath the anus, and then runs ventrally on the midline over the chest, the neck, and ends just beneath the lower lip. And the governing vessel would be yang in nature, and the conception vessel yin. So there we have the opposites again. But governing vessel 1 is a good point to include, also to include with ulcers. And it is in a depression between the anus and the ventral tailways. It strengthens the kidney and the yang and supports the guts as such. So that's why it's good to include it there as well. Also, Western indications are obstipation, diarrhea, pain of the caudal bag, and urogenital diseases. So, and then we have one for the spleen. And that's spleen 9. And spleen 9 is in the depression just ventral to the medial condyle of the tibia, caudal to the caudal border of the tibia, and over the popliteus muscle, and cranial to the saphenous vein. I will add in the downloads an image of the full leg so that it becomes clearer, not only this excerpt. As a point on the spleen meridian, it benefits the spleen's function of transport and transformation. And Western indications are also diarrhea, pain in the area of the hip and the stifle, because as a local point, and urogenital issues. So we always can use acupoints if we have a problem in a certain area. We can always use acupoints that are basically in that area. So also if I have problems there, so that's why especially this one with the stifle, because it's very located to it. And also if the meridian then runs through that area, because when I work on a point close to it and then the meridian runs through it, I'm basically addressing that area through my work. So, and that was only, that's only a selection of points for ulcers. There are of course more points available, and it also depends a bit on the individual case. So because what we're doing here are basically recipes, but an individual assessment of the horse may give you a better idea of what points are best for that particular horse, because there are, with our Western indications, there are certain points that work very well with them, but we may have Western indications and in Chinese medicine certain variations, what it actually would be from a Chinese point of view. So, and we look at diarrhea, and this point, for example, spleen 9, you can also use with diarrhea. And I've only one point that I would like to emphasize in that context, because it is we just had it before, the governing vessel 1, but it's that one point that I would recommend always using with diarrhea. So, and then you can add certain other points to it, but just don't leave this one out. So you could basically use this one and then add one for the spleen, and maybe use one of the large intestine and then add certain ones that we may look at now when we look at points that you can use when you're waiting for the vet for a colic. Again, that's general points, and we are not going into the specific of what type of colic. Those points now you can use with any colic, but you would maybe add certain different ones depending on what type of colic you're dealing with. So, and there I have a few on the bladder meridian, the association points. And those are all points. So just for those attending the first time, that's the association points. All of them, there are 12 points, and each of these points is connected to one meridian, major meridian and organ. So we have, for example, bladder 13 for the lung, bladder 14 for the pericardium, and bladder 15 for the heart, and so on. So, and now we have those for the digestive tract. So that's bladder 20 for the spleen, bladder 21 for the stomach, bladder 25 for the large intestine, and bladder 27 for the small intestine. You can also use these points in general to support the digestive system. The way to locate them is basically bladder 20 is in the last intercostal space. The horse has 18 ribs, so it's in the 17th. So you basically find the last rib, and then you have the last intercostal space here. You follow the line of it upwards, and you are approximately a hand width from the dorsal midline. That's where you have bladder 20 for the spleen. And bladder 21 is just behind the last rib. So again, you find the last rib, you follow the last rib, and you have one hand width from the dorsal midline. You have bladder 21, the point for the stomach. bladder 25 for the large intestine and bladder 27. Those two you can easily look. There's an easy way to locate them when you have basically the hip bone, and when you go along it, then at the front, you've basically come directly into bladder 25, and at the end, you've come to bladder 27. That's the one for the small intestine. But I will add a video for that into the when I upload the replay. Again, you can use governing vessel 1 to support it, and because it's both obstipation, diarrhea, and generally a point to work with if you have problems in that area. And then we have by Y, which you may remember from the previous session. It's on the dorsal midline in the lumbosacral space. You basically the highest point of the group, and just in front of it, on the dorsal midline, that's where you find by Y. Even though it's on the governing vessels, it's not a point of the governing vessel, but it's what is called a classic point, because there are certain points that are not on meridians, or in this case it's on the vessel as such, but just doesn't really belong to it. And it's a point at which all young meridians merge. So you basically influence them by working with it. And other indications are any hindquarter issues, problems of the hip joint, and back problems. So, and then I have one that I just wanted to include as well for digestive issues, and that's, also know that one already. It's stomach 36. So stomach 36 is in the depression just lateral to the distal aspect of the tibial crest, craniolateral on the tibia. And it is the master point for the cranial abdomen and the gastrointestinal tract. So as the master point for the gastrointestinal tract, it's a point that you can always include in issues with the gastrointestinal tract. And as indications, I also have ulcers here. And there's one reason why I didn't include it in the points for ulcers, because there's some disagreement in the literature. I found that certain acupuncturists include stomach 36 in ulcer treatment, but there are also, especially one which I hold in high regard, who says stomach 36 not for ulcers, and I just didn't want to make a decision on it, so I just leave that to you as information. So I know there's respected acupuncturists who have stomach 36 in their treatment protocol, and others that have for certain reasons not. But generally, it's a point that you can really use and include in any digestive issues. And we had it, I think, probably the third time, if not the fourth here, because it's just a point that is so effective with very many issues. So it's also a good point for immune stimulation, any stifle problems because of its location, but also with lung problems like coughing and asthma. But again, it's one of those points that is particularly contraindicated during pregnancy. So, and It's repetition again for a few of you. So the way you can work with those points, I have two basic point work techniques. One of that is the thumb technique, where you work with your thumb on the point and in a 45 to 90 degree angle. And as a guideline for 30 seconds to a minute, but basically it's about developing feeling with practice, that how long you should stay on the point and how much, and work with the horse together. It's communication, it's cooperation, and it's a lot of horses basically tell you when enough is enough, and sometimes you think it's enough and the horse will tell you no, it wasn't enough. But as a guideline, just about a minute. And you can do the same with your index finger, with the tip of it, and you place the middle finger on top of your index finger and then work on the point. And the pressure is very, very gentle. It also is, again, it depends a bit on the horse. So I would usually start with just placing my finger on the point, and then I work with the horse if there is a bit more pressure needed, but it's never much pressure. It's always very gentle work. So, and before we finish, I'd like to go back to the association points. So I don't want to add more confusion, but I just don't want you to get confused when you may go to different literature. And I have the association points, and I give you more of the location and what association points there are, like bladder 27, the small intestine, in the downloads. But what I want you to be aware of is also there are basically two main different systems in acupuncture, acupressure, in veterinary acupuncture, acupressure. And one is the transpositional, and called the transpositional, and one the traditional. And the this is the transpositional. I've chosen this for this webinar series because it's the more common one that is applied. And it's basically where the human concepts of association points was transferred to animals and to veterinary medicine. So you may, the traditional point, approach also works with the association points, but they would have a different order. So for example, here, those two would be related to the kidney. And it's just, I trained in both systems. So when I work, I have basically both in my head, and then go along and take this into account. It's just when you may open a book and you say, oh, these points are in a totally different order, that may be the reason. It's also the traditional system. They today also work with meridians, but it was in old Chinese veterinary medicine, whereas they had in human medicine the meridians. On the animals, when you have acupuncture charts, there were no meridians, so there were only points, acupoints on the charts. And that's also where our classic acupoints come from, which are not on meridians. So I hope that is somehow clear that we have the association points in both systems, but there may be associations to different meridians and different organs. And this one, the transpositional, is the one that's most commonly used in veterinary acupuncture, acupressure today. So I'm at the end with this now. Do you have any questions? No, also fecal water is quite a common problem these days. And again, you can, for example, work with spleen, with this point for the spleen, spleen 9, the governing vessel 1, but there you would also strengthen the kidney because it's very much related to, and governing vessel does strengthen the kidney, because, but you may add other points for the kidney as well, because it's very much has an important function with water metabolism.
Hi, I'm Heidi.
Hi.
I've got a just a question. I know
Yes.
going through the literature, there's some foods that are sort of more appropriate at different times of the year, and I just wondered if that would apply to sort of ulcers, if there's anything that you could actually feed.
From a TCM perspective, or in general?
From a TCM perspective.
It could be. Do you have an example? Or
I don't know.
No, you mean in general. I know that I think it's a bit difficult to apply with horses, but there are, of course, actually I don't know, and I see the difficulty with, because horses are so particular with their eating and feeding patterns. I know that there is TCM diet, and I would know a bit about how you can support dogs with certain foods, but the variety with horses, we are just a little bit limited, but maybe somebody else could give you more clarification. You mean, but for the time of the year?
Yeah, like there's some bitter foods that you would feed at a certain
I know,
time.
with herbs and certain things.
Yeah,
Yes, for sure.
yeah.
Yes. But I would always need to do my homework
Right.
on that as well.
It's a bit more involved than just saying.
No, if it's just something I'm not
Try this.
dealing with on a regular basis. But
Right.
yes,
Okay.
yes. No, it's an interesting question. And if I at some stage dig deeper, definitely.
Yeah.
Yeah.
I just thought, yeah, I didn't know
No,
if
that
there was
makes
something.
total sense. Yes.
Yeah.
Yeah.
Okay. The other one was about the ulcers, the percentage of different horses that have ulcers, like thoroughbreds, are so high. And I just, there probably hasn't been a study, but it would be interesting to see, if ulcers are prevalent in wild horses,
if with the numbers, I was wondering that myself, with the high number of foals already presenting with ulcers. And I would be really interested in it as well. What I could find, because it was just that really also with foals, I was coming across the statement that it is part of our management.
Yeah.
And but of course I also would like to see the comparison with horses that are in the wild. Yes. To what degree ulcers are present there. Yeah. And Nikki just makes a good point in the chat box. I think you don't see it all. It's only me who can see it. So she says self-selection herbs is a great way forward for horses. Yes, it's a zoopharmacognosis where you basically where horses are basically able to select the herbs they need. And I think that's just a problem we have today, because our pastures, the majority of it, are so deprived of variety that they would have access maybe years and years ago, and they would select themselves what they needed at certain times. So I think what we really can do is improving the quality of our pastures and aiming for more variety, so that doesn't make us, so that they can already choose and select what they need.
Yeah. Yeah. Thank you. Yeah. Thank you.
So any other questions on this? If not, then I thank you for your attention, and I just want to add, because this is the final day in that webinar series, but because in the German group, they were very interested to get to know more about the elements and what all belongs to it. And also in particular, because of the horse types in relation to the 5 elements. That means what particular, if a horse would be more an earth type or a metal type or a wood type. I always add caution to that, I also have to say, because I think things can shift and change, and we have to be cautious in categorizing things and putting horses also into boxes. But just in general, that if you can identify, okay, that's more an earth type, how you can use that to support the horse stronger. So that's why I added 2 additional dates in March. And otherwise, yeah, thanks for being here, and I wish you a good evening. And if you have any questions, please get in touch. I also hope that with COVID, there will be the opportunity for hands-on courses in the not so far away future again. Thanks. Bye-bye.
Thank you. Cheers. Bye.